Good morning. My name's Rob Proctor. I'm the Vice President of Enterprise Solutions at PartSource. We're the leading technology provider for supporting mission-critical equipment. I'm delighted to introduce our speaker this morning, Mr. Ben Lewis. Ben has been a wonderful HTM leader in the community, as well as a wonderful partner to PartSource for well over 20 years. He was one of our first members of the PartSource Pro community. And we've worked together to build strong partnerships in two large organizations, helping to drive out hundreds of thousands of dollars of cost and parts, as well as efficiency.
I've been doing this a while, probably millions.
Millions. Yeah, okay, yeah, fine. Yeah. With us.
Yes, with you. Yes.
Yeah. As a matter of fact, I think your first order with us was over 20 years as a biomed.
As a biomed.
Yeah. And recently, Ben came to our annual PartSource Leadership Summit and spoke on right to repair. And let me tell you, you're in for a real treat. Ben's passion and commitment to patient safety and efficient healthcare operations is evident when he speaks. He's a true thought leader and change agent. He's going to talk a lot about that today. And elevating HTMs is top priority for him. But it's also a top priority for us at PartSource. That's what we wake up every day thinking about, is how to elevate health systems HTM departments. Please come by booth 700, a little commercial there, to talk with us later today if you're interested in learning more. Ben, let me turn it to you.
Thanks, Rob. Appreciate it. Can you hear me? All right. Elevating HTM. I never really, the way you said it, I like that, Rob. I joined the Army at 18. I signed up. I went to the recruiter station. I said I want to be a biomed or lab tech. They said, we can make you an MP. So I don't want to be an MP. And then, yeah, you're the same, right? Right. So I said, well, I was in Nashville, MEPS, and I said, bring me back to the house. And they clicked on their DOS computer, pop, 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 pop. Something just opened up in biomed. You'd never believe it. And so the military took me, and that was the beginning of my biomed career. And I really identify as a biomed. My obituary will probably say, Ben was a biomed, right? That's what I identify as. So happy to be here. So the session objectives we're going to explore today is how HTM broadly impacts your organizational strategy. My last role was an associate hospital administrator at a level 1 trauma center in northern Arizona, and I really got to experience HTM from a new lens with being in the C-suite. All right, strategies to align your HTM department's mission with your organizational goals. We'll talk about that. Insights into future trends, techniques for effective communication with the C-suite, and considerations on career development in this field. This is just a heat map I made of kind of my biomed career, and I don't know why I clicked Texas. I went to high school in Texas for a minute, but I never worked there, so I must have been sleepy. I was stationed in Scofield Barracks, Hawaii. I've worked primarily in Tennessee, Georgia, North Carolina, Arizona. So again, started as a biomed. I did end up, my career went into FM and supply chain as core competencies. That's an important part of healthcare. If you are an HTM, a lot of you may even report to supply chain. It's a great relationship to have. Strategically aligned HTM departments with organizational goals. My role has been really solving problems. Leader of leaders. I've led a 9-figure budget with over 9 FTEs, and I'm now rolling into a new company. I've got a recent announcement that I'm going out on my own. So enough about that part. Oh, this was for we got any Marines in here? Marines? No? Okay, this was for the Marines. Hey, I joined the Army, I turned a wrench, I went to school, I worked hard, I got lucky, and I stayed mobile. This is actually the most important part right here, is staying mobile. If you're willing to get up, and I love Marines, I'm just joking. So if you're mobile in your career and you're wanting to advance, that's the place you gotta be. I've seen some of the best talent not be mobile and stay stagnant in their roles. Understanding and communicating the critical role of HTM and how it relates to the healthcare organization. So financial performance. So these are topics for the healthcare organization. They primarily, and they end up on your balanced scorecard. They primarily are going to be finance, growth, quality, people. So this is a kind of a outline of that. So financial performance, we're going to impact their operational margins and their revenue growth. Patient customer satisfaction, where they focus on the patient and the quality, we're also going to impact that with their clinical outcomes and their patient safety indicators. Internal processes, operational efficiency, and care delivery. So these are words and these are things that, again, start connecting you to to your senior leadership. When you start talking about, you understand that HTM impacts length of stay. When you start talking about that you understand your LWOPs, left without being seen, that's a metric that your CEO is going to cover. Well, if you have a down cath lab or down CT, right, and they're sitting in the ED for 6 hours, your LWOPs are going to go up, right? So understanding that you understand, or knowing your leadership, knowing that you understand that is important. And then the fourth part of of the way it connects to the way you connect, or your department connects, is learning, growth, and staff development. And there are KPIs and KPIs that your leadership is going to be looking at, your employee satisfaction, your turnover rate. These are all things that it's going to be important that you can speak to, and that you know how it impacts your leadership. So again, kind of to cover that again, we can reduce costs, reduce downtime, increase throughput, extend the life of our capital budgets, also positively impacting our financial performance. We reduce risk, obviously, and we work and partner with our patient safety teams. That's interesting. I mean, that's a very important partnership that you're going to want to have, because your C-suite has a good relationship with your patient safety team. They should, right? Your C-suite and your CNO. So your CEO, your COO, and your CNO are all tight with your patient safety person. You guys need to be on the same wavelength. All right. Start times. That's a big one. That's your first time start time in your OR. Your CEO is going to be looking at that. And are you impacting it? And do you understand how you impact it? So developing a strategic plan. This is important for your leadership to understand that you have a vision, right? That you're not only reacting to what is happening. So you should have a plan for your leaders to understand that you have immediate goals right in front of you, and you have near goals in the next year or two, as well as you have a future vision for your department. What does it look like 3 years from now or 5 years from now? Recently, 5 years is, you're holding a crystal ball at that. It's with as wild as healthcare has been, but 3 years is a reasonable time frame. Establishing initiatives and tactics. So when you set goals for your departments, goals are great. Tactics are how it gets done, right? And we'll talk about that a little bit more. And then make sure you're doing regular progress and check-ins. I think that's a place that we have to push a little bit harder. I'm going to break it to you that, and it hurts my feelings too, that our CEO is not always thinking about HTM, right? I know that surprises you, but pushing for that and letting them know why they need to make the time for you, right? If you allow that gap to exist and to continue, communication barriers can exist. I wrote this one down. So Al, anybody a musician here? Is anybody a musician in the room? Not one musician? You are? What makes a good musician? Feeling the music. That makes good music, right? But what makes a good musician? Dedication. Okay. Yeah, that's true. All right, passion, right? So I guess let me lead you where I was trying to get to is I think when we turn on the radio on top 40, right? Are those the best musicians in the world? No, right? But we're listening to it. That's what we're hearing. My point is what makes a good musician to a musician and to a listener are different things, right? So the technical, now let me bring this back to biomed. Often what biomeds will I know I did when I was a tech, right? I thought, look, I saved $300 on this part, but it took an extra day, right? But I fixed this and I did not call them in, but it took a little more time, right? You see what I'm saying? So, but then there's that pride, you push. So the point in this comment right here is make sure you're taking your action in the best interest of the organization at a higher level for your leadership to see, right? So meaning this, your technical competence may be great, but your leader cares about uptime, right? Throughput, bed availability, right? So that's that kind of that point is focus on those things. Uptime, is that's what your leadership's going to be wanting to talk about. HTM programs don't develop at the same time at the same rate, right? So this is kind of how my HTM programs have developed, right? Things go well, you lose a bunch of people, change in leadership, so you can grow, then you stagnate and grow, right? So develop a strategic plan that supports your strategy, and having a long-term strategy will create some more stability in that. Ensure alignment in the future technology standards and integration, reducing risk and waste. So developing a strategic plan, that's what these will do. How many people have received maybe a monitor, something like this, monitors from your team, right? Purchasing from someone that, or a department ordered monitors with Massimo SpO2, and you don't use Massimo, you use Nellcor, right? This is why you want to get integrated into your, align into your future technology. You're going to improve your patient outcomes through care coordination and communication across departments, ensuring holistic communication and holistic care and continuous care. An example of that would be partnering with your cath lab director and figure out, and to work with them and find out what's your top line revenue on every day. I do a PM in a busy hospital on Friday, right? I have to cancel cases, or I have to not do cases, or I have to not have that block timing. So I want you to think about block timing is very important. Not have that block time available for those physicians. So think about this: is your CEO going to be more worried about $2,000 extra, or $1,500 extra to have a weekend PM in a busy cath lab and keep your block time opening, right? Well, it depends on what your margin is and how busy your cath lab is, right? But these are things that you need to understand to be able to partner with your leadership. And also developing a organizational strategy long term. It's going to grow your program. You're going to, like Rob Burdick, you've got a long-term strategy. You have a name in the healthcare. Your organization has a name. What does that do? Attracts talent, right? Rob is engaged in this industry. That's a good thing to know when you go into work for someone, right? And so that's how you attract talent too, is building strategy, and coming to places like this is where you get the ideas to build strategy. We were talking about tactics earlier. This is a example of creating strategic initiatives without detailed tactics. So this is the parable of the builder and the castle, right? So the builder has an inspiring vision but no plan. I'm talking about creating goals for your department, but really now you have to, it's your time. The goals is the easy part. Being the leader and completing the action is the more difficult part, right? So inspiring vision but no plan. Uncoordinated efforts. Have you ever done that? RACIs. Anybody know what a RACI is? Al? Yeah, responsibility, accountability, consulted, and informed, right? So that's one of my main tools. If I'm partnering and collaborating with another department, I want a RACI, because I want to know what I have to do and what they have to do. I have a color-coded Excel sheet. If you my contact information, and if you want to just check it out, and we could put an R in it, turn this color-coded, and really you want one person is responsible, right? I'm sorry, one person is accountable. That's you, the leader. The person that's in charge, you're going to be accountable. You can have multiple people responsible, but I really don't like to have more than one person accountable. Sorry about that. IT and facilities management. These are the partners that I have the most races with. And then between your medical device security and your IT security, you'll have a racy. All those close partnerships, you'll have a racy. So everyone's duties are coordinated. So the lesson learned from the parable is the goal provides direction, but actionable steps and clear plans are essential for success. I think I'm going fast. All right. Effective communication with leadership. Building trust. Educate executives on HTM missions and impact. I had about 15 months in the C-suite, and I was really surprised at the lack of understanding of our total mission, to be honest. And what meaning more broadly, when I say that, I mean that with empathy and grace, right? Because I did not realize how broad and wide healthcare was, right? There's people that there's groups that I worked in for 20 years in healthcare and never thought about, and just healthcare is much broader than you think. So I have a lot of grace with that, but I just thought that they knew more about HTM than I did, or than they did, right? So even HTM, even in C-suites, they don't, it's not a common term. So how many can define it? So speaking their language, I do think that it brings credibility to you and interest from your leaders if you are using metrics and KPIs that matter to them, right? They're going to be on the balanced scorecard for your organization, so you can find them. They're easy to find, right? All right, and highlight how HTM affects financial and quality metrics. They're going to want to know, and they may not know, right? So, for instance, when you go through a capital plan, and they ask you, can you keep this alive for 2 more years, Rob, right? And you said, yes, I can. That's what that's doing. You're extending your capital, and you're impacting their metrics positively, right? It's more than just, can you make this live? You're impacting my EBITDA, right? All these other things. Well, actually not EBITDA because that's capital, but all right. Regular engagement. Schedule those updates as discussed before. Invite your leadership to department meetings or tours to get them engaged, because if you matter to them, or if they matter to you, you'll matter to them. And insert yourself where required, right? I mean, I think that's, as a leader, I want someone to insert themselves when I'm needed, right? Because I trust your core competency. You were selected for the role. You may have been promoted into the role. And so as a leader, be confident in that it's your role, because it's your core competency to inform your leadership on HTM. Quality events. This is if anybody's got a story they'd like to tell, raise your hand on this one. But discuss equipment events. I had during my career, this is an example of discussing with leadership and really educating them on HTM. So you'll have an adverse event or quality event, right? There's a IV pump or a piece of equipment involved. Doesn't matter what it is. In my experience, with a high percentage, the equipment gets looked at first, right? I mean, first, and then it takes a long time. And then what that does is it's very rarely the equipment. What was the numbers yesterday? 3. I mean, there's use errors, right? But when the FDA, from the keynote speaker, he was discussing that there were 3 out of 2 million that were due to deaths that were due to calibration, right? So why are we starting with equipment, This needs to be a discussion with our leadership, right? And so discuss quality events. I have turned a couple of C-suites around in that, in their culture and thinking, just by giving them data, right? And like, how often does your cell phone, solid state digital technology, call someone you don't ask them to call, that you didn't pocket dial, right? And so the point is that solid state digital technology is not the #1 culprit for safety events, and your culture shouldn't be that it is. So that's a discussion point for you. Communication is key. Senior leaders want it quick, right? So fast, and being able to get to your point as fast as you can is going to have them let you come into their office when they're busy, right? he's gonna drop the point. He's gonna roll out. Map department objectives to overarching goals. This is I don't know if I have anything else in this slide about this, but this was a big one that I like to do, is actually take the balanced scorecard, or the system strategy, and completely connect them without even changing the words. So I would take the systems strategy goals and connect HTM goals directly to them, and then talk about how they would impact it. There are a few goals that were difficult to connect, but most of them you were able to. So again, this is a discussion with your leader to train him on HTM. When you meet with him and you say, this is how I impact this goal, this is how I'm going to impact this goal, your strategy goal, and just go down the line and touch on how HTM can impact that. Stay informed in healthcare trends and participate in cross-departmental initiatives, and even lead cross-departmental initiatives. Right. That's right. That's right. Yes, exactly. Broader, less technical talk on how you impact their KPIs on a balanced scorecard is going to get you that. Exactly. Thank you. So, anybody remember this movie? Anybody know who this is? I used to like him. I wanted to be him when I was about 13, maybe. And Antonio Banderas, right? So this is a movie called The 13th Warrior, and in this, he's a Persian man, and he and a group of Norsemen, which you're going to see in a second. They are on a mission, I think, to fight a witch. I don't remember, but that's not the point. The point is that he does not speak their language, right? And so there's a scene in that movie where they travel in the day and they sit at night by a fire, and every night by the fire, he just watches and listens and learns, right? Watches and listens and learns. So this gentleman talking, he's looking and he's learning, right? So what is he learning? I hope he's learning about net patient revenue, or, supply expense per net patient revenue, right? So I hope this is, to draw it back to healthcare, and you're going to get a chance at some time to really connect to what Al just said, to really connect to your leader's goals, right? And when you do get a chance, you're going to speak up like Antonio there, and everybody's going to look at you. Right? This is the CNO, right? CNO. But anyway, so they are going to, it's going to grant, that's getting you credibility, right? And here we go. Take the time to learn the language of your C-suite and key leaders. Things like SE for NPR, PSI for patient safety indicator, your EBITDA for your finance. Be able to speak to accreditation points that may be outside of your expertise, and that's going to really show growth. This anecdote shows the importance of communication and growth possibilities for an individual in unfamiliar areas when the discipline and consistency is applied. So obviously, and HTM gets to be Antonio, right? And then, yeah, there's your C-suite there. All right. Okay, another point on this word map or a word cloud here. If you look at the word cloud, this is I went into Chat GPT and I said, describe the most important topics that should be to healthcare executives over the next 5 years in healthcare, right? I think I messed that up here. So take a look and soak those words in a little bit. Does anything jump out that you guys are looking at your hospital? Like how familiar? Okay, I should have actually started with this one. So how does that one look? How familiar is that one? A little more maybe, right? And so this is an explanation, is a visual representation that can quickly kind of get you into the difference in your worlds, right? And they do overlay, but they're not the same. We're gonna start talking because I gotta hit 50 minutes fast. Future and growing trends in HTM. That's what AI said. I told AI to draw me talking to Benjamin Franklin. So that's the person that I would like to have dinner with, if I could have dinner with anyone, just because I want to tell him what a cell phone is and try to see if I can explain it, right? So that's growing future in healthcare. Could we even see the future? This is Ben Franklin. Could he see our future, what we have now? So that's kind of the topic. You know, we're going to try to see the future, but what does it look like? AI, obviously. Predictive maintenance. Anybody have any thoughts on predictive maintenance for AI? Rob, are you looking into it yet? That's right. That's right. And for this, any thoughts on corrective maintenance strategies for AI? Anyone talk to CMS? Is CMS doing anything that you can talk about, or what do we think about AI prediction description codes on so just AI, you put a problem code in it, it looks at the model and gives you a likelihood of issue, right? You know, based on the description. Are you guys working on that? Is that out yet? I hear people are. Yeah. Agreed. I think this is actually coming out from the OEMs, also for their own field engineers. Yep. So let's look at it in diagnostics. There's a ultrasound company I met with recently, and their AI diagnosing model for patients, right? Which I don't know is too much different. I mean, let's think of, like, I would imagine it's more complicated. So on this specific study, using their AI, not using AI, a 3-year, and I don't remember the exact statistics, but this is going to be pretty close, has a 22% chance of finding this particular liver tumor, right, at that stage, as a 3 or 5 year radiologist. As a 20-year radiologist, they have a 76% chance, right? Now, turn on the AI, and that 5-year radiologist has a 76% chance, right? So could someone be misdiagnosed from that and not have that tumor? Yes, right? But would you want to use would you want to use the ultrasound that had the AI or didn't have the AI, right? So I think that's that we have to really, it's a struggle on the decision and when to implement it or not. Absolutely, yeah. Good point. When I think about troubleshooting in the future, I think, I do think we asked the wrong question. I think that we should be looking to manufacturers to create equipment that break less, right? Now, here's my question, and I'll just touch on it just real quick and then move on. Why would they be incentivized to do that if over 50% of their margin is in service and repair, right? So I support them in their total margins because it drives innovation and investment in healthcare. What I don't support is making that margin on maintenance, right? I'd like to see them make more reliable equipment and break less, push that margin to capital, which will positively impact your EBITDA. But don't do it on, don't make your over 50% of your margin on service. It's not reasonable. Would you buy a Ford truck if Ford made over 50% of their dollars on service? Probably not, right? Yeah. Okay. So I think that's an opportunity for us to push that initiative. Back to, these are IoT and cybersecurity. These are growing roles. They're not new, but they are going to grow. We just keep getting more and more integrated and connected. And then volunteering for future roles. Here's the one that I want to talk about after this class when you get a chance, if you'd like to. It's called AI Vision, and how is it going to impact healthcare? Big time. How is it going to impact HTM? You guys are going to tell us how it is. So how it does. An example. I was in a room not that long ago where we were talking about AI, and we needed there's a job that does not exist. Meaning there's a need that there's no job for right now, right? And no department leader in the hospital, and they said, we need someone to code use cases for AI vision. And what I mean by that is this. Here's an example I'll give you. Hey AI, so the cameras have 1080p on them, and AI is you're pushing it into an AI program. Hey AI, this is what EVS looks like. They wear green scrubs. When they walk out of the room and they hit the nurse call button and the top light turns on, that means this room's available. Immediately let bed placement know. That just crushes your bedtime. My wife's a nurse. She told me this. I've never seen a nurse do this. Sit on a room, right? At the end of a shift, right? It's a joke. Sit on the room at the end of shift. You have turnover. It's at the end of the shift. You don't want to get report. You don't want to give report. It's not the best, right? But you're also in a high throughput hospital, etc. These things are going. AI is going to be introduced this way in the future, right? And it's almost that simple. So they said, we don't have someone for this. I raised my hand. HTM will do it. We'll volunteer, right? And so integrating, inserting ourselves into value for future roles. I think that's a great opportunity for us as an industry. Another way we might use this. Imagine if you do $20,000 or more with a vendor, right? And they come in and they say, well, we were here 6 hours, and you're in a 500-bed hospital. You may have saw them, you may have not. What if the camera out in front of the biomed shop, you code it and say, hey, AI, when someone does this with a badge and it can read it, that's a clock in, right? And when they're clocked in, if they do the same thing, it's clocked out. And then you say, hey, you change your master service agreement with supply chain with that vendor that you do over $20,000 with. You don't tell us how long you've been here. We'll tell you how long you were there, and if there's a difference, you let us know, and we agree to a trip rate, right? These are ways you're going to really crush your T&M down in the future using AI. So just it's a real fun case to think about what the future holds with AI and AI vision. So considerations to go back to earlier was to be able to, I don't know, I think I mistyped that. Sorry about that. Future roles, let's talk about that more. I think I got into that slide early. AI use case coding visual, we just talked about that. Anybody have any thoughts about that or use case thoughts? Hit me up after class if you want to talk about it. It's really exciting. Telehealth is going to grow. That's going to grow. Medical device integration, AI driven. Robotics maintenance. Anybody know what year the first robotic surgery took place? Reagan was president. 1983. Yeah, it was the first robotics. So VR, AR systems manager. You see that coming? I mean, if you've seen the technology here. Nanotechnology equipment manager. That's one. I don't know if that's going to be a supply chain or the HTM. That's a future role. I was reading an article the other day about nanotechnology, cancer-eating nanobots. Right? Future's here. Blockchain application specialist using blockchain for cybersecurity. That could be an HTM future role. Anybody have any thoughts about what's missing? Anyone from the back row? Was it anybody? No? Nothing missing. Al, there's got to be something you don't see. You'll also want to develop titles and titles for the new roles that are coming in the future, and job descriptions. So I agree with that. I think we dig back into the slides. If we are doing these things that we talk about, it is managing that managing technology in totality. Great point. And that kind of goes. Oh, I think I hit the wrong button. Well, let's go into career development and guidance. So this is another point we want to talk. Pursue your skill development for your interested path, right? So you're going to have more opportunity, right? If you're interested in AI and you're in HTM, you will have an opportunity to bleed into that space if you're really passionate about it. Solve problems outside of your comfort zone and discipline when appropriate. That's how we get where you're talking about, because we've already come so far away, like you said, from that clinical when you're we need biomed to, for this balloon pump insert. We've already come so far away that we really have to prove our value and our skill in these areas. Again, by partnering with people outside of our comfort zone. I've spent a lot of time with CNOs in the last 3 or 4 years, right? Further outside of my comfort zone, and but really allowed me to see my customers' concerns in a new way, right? So seek mentorship in and outside of your organization. So you're going to want to have a business partner in your organization that you consider a mentor to speak to and give guidance to, talk about your future career goals and aspirations. And really, so an example, I'll tell you, this is a story I want to tell you. When I was a kid, I would drive around or ride around in the back of my parents' car to these big houses. And I said, what do those people do? Right? Just a bit, big, what do they do? Now we have what? LinkedIn. Now I can just go figure out exactly what they do, right? And say, what role do I want? What education did they get? Right? What skills do they have? And I can market myself and put myself on that path. So what we have is tools available to us that we did not have, 25 years ago that we should be taking advantage of. And then again, lead new initiatives and embrace digital transformation, because it's coming, right? I mean, you can be a barrier, or you can be a leader, right? So I have seen HTM programs, or just people in general, where say, yes, but right, and you're not leading, you're not pushing the organization initiative. Now you do want to have, there is risk. We are in a business of risk, right? So that is our job to consider that. But I think leading the initiatives in a way where your organization wants to give you more is that's the way to get where you said, Al, moving back into that HTM total management space. We got to get ACI credits for this, and I made it, right? All right. So we're about done. Invested soft skills, DISC. Have you ever taken a DISC survey? Have you taken a DISC survey? I know. Are you a high D? Are you a high D? No? We'll talk about it. But behavior predictive index.